Back to COVID-19, with rising hospitalizations, bed space is becoming more scarce. Luckily, technology is on the forefront to limit some non-COVID patients' stay, and one tool is a robot that is getting early lung cancer patients in and out of the operating room on the same day. Very rarely is a cancer diagnosis good news, but for Holly Morrow, it saved her life.
If I hadn't have gotten the tongue cancer in July, they wouldn't have found the metastasis from my breast from 20 years ago, probably until a time that it would have been too late.
A scan of her chest found a nodule on her lung. She was referred to Dr. Wael Hanna of St. Joseph's Healthcare and introduced to the Da Vinci 11, a robot that Dr. Hanna says works as if Superman were performing the surgery.
Your vision is 3D, high def, 4K, magnified 2.5 times. So you're seeing much better than what you would with your own eyes on the screen. If you hold your hand and you look at it closely, there's a bit of a tremor in there. The robot doesn't have that.
Normally, a human-only lung surgery results in pieces of a person's lungs being cut out, resulting in a 4-day hospital stay and an increase in vulnerability.
In this environment, God forbid they get COVID-19, less healthy lung to use to fight the virus.
But for Holly, it was the opposite experience.
I had surgery on a Wednesday morning at 9 o'clock, and I literally walked out of that hospital the next day at 2 in the afternoon. I was able to breathe fine. Like when I got home, my breathing was fine. I've had energy. I'm out with my Fitbit walking.
The operation doesn't only benefit the patients going under the knife, but others dealing with different illnesses.
If you ever have to ramp down capacity because of a surge in COVID cases, these are some operations that are cancer operations that you can still do because they take so little hospital resources.
Despite the rapid turnaround, Dr. Hanna says if there is a sudden surge of COVID cases, patients waiting for the operation could pay the price.
For these patients who have an early lung cancer, kind of sticking around waiting to be treated until the pandemic eases is very detrimental to their chances of cure.
The Da Vinci robot isn't used for all lung surgeries. Only those who are dealing with early stage lung cancer where the tumor is smaller than 7 centimeters are eligible.